Good afternoon, everyone. I'd like to get started and hope that everyone who wished to join us is on the line at this point. This is in webinar style, so we can't see you, but I can express my own gratitude on behalf of the senior staff and others for your joining us today. You've submitted a lot of questions, and we're going to try our very best to get to every question. And I would like to begin with a few opening remarks that may help set the stage for what you now, I hope, have read in our plan. The plan has been sent to all faculty, staff, and students, and it includes two documents. One is a narration of an executive summary that was presented to the UNC system leaders. Provost Campbell thankfully narrated this and I think brought alive some of the concepts that we were trying to convey in this plan to make every attempt with the best health protocols in place to return to in-person instruction. I would urge each one of you to read both of those documents, both listening to the narration and looking at the executive summary. And please read through all of the details that are in the long document accompanying that narration. This plan is as good as today, and we think we will be updating this plan about every 3 to 4 weeks from now until the middle of September. Why? Because this is an ever-evolving situation, and each and every day we come to understand better new information, new best-in-class, best-in-practice health protocols that we can adopt, and new ideas for ways to keep us all safe and to get us back to some approach for as many as possible to have in-person teaching and in-person instruction. We're still working out so many details, and many of the questions that you have, we'll just have to say we're not sure at this point. But we promise to keep you posted on this. We'll update and refine the plan, as I said, every 20 to 30 days. Throughout July, August, September, and even into October. And your questions are useful to us because it helps us to attend to things that might not have been on our radar screen before this time. I hope we'll have town halls available for all of our students, faculty, and staff as a community about every 2 to 3 weeks, so that as you have questions, you know there's a place to get them answered. And of course, for Provost Campbell and me and for the others you see on the call today, we welcome hearing directly from you to try to give you the best answers that we know at that time. I am fully aware that many of your questions reflect deep concern about opening for in-person instruction. Some of the questions reflect some of the feelings, frankly, that all of us, even on the senior staff and the EOC, have been feeling. Fear, uncertainty, lack of clarity on what the campus will feel like and be like, what it will be like for all of us to wear masks, and more on that in a minute. And I assure you that I and other members of the senior staff, together with David Weldon in emergency operations, understand the level of fear and uncertainty that you might be feeling. Amidst that uncertainty, the system is asking that all 17 of the universities open, and we are doing that in the spirit of their request. We also want to be a resilient institution. Knowing that COVID will be with us for some time, there must be a way to return to some business as usual regarding the service to our students and the need of our academic mission, including the continuity of employment for all of our employees. We want to be the best and safest place we can be. We also know that the mental health and persistence in higher education of some of our students is directly related to our ability to open and welcome them back to campus. Some of our socioeconomically challenged students, some of our first generation students, some of those who need extra support for student success and the completion of their college work, are longing to be back because it is our university campus that gives them the best possible place to gather with their peers, to experience the talents and depth of understanding of our faculty, and to preserve their ways of socializing and experiencing strong mental health with their other colleagues and students. One question we have that we have received from one of you, and several intimated in the question you ask, are we doing the right thing by opening? Are we putting people at unnecessary risk? While I cannot say that the risk goes to zero, I can assure you that we will only open if we are sure that we are following and asking each and every one of us to abide the highest sense of health and safety protocols. We are clear that the system expects us to return, but I have also seen real proof that the system will support the securing of PPE and setting standards for those health protocols. Just yesterday, the State Office of Human Resources has decided that every person who works as a state employee must wear a mask at all times unless they are in their office alone. And if a mask is not on them in the office, they still need to disinfect their offices. We're learning more about this as it was just made yesterday. That helps us as an institution to require face coverings of some sort, a bandana, a mask, a face shield. That will be required of all of us as we return to campus. And for those unwilling to agree to that, it may be best that you sit out this semester, because that is now a state mandated requirement of all of us as employees of the state. We also want to make sure that our disinfection protocols, our self-care, our ability to support symptom checking and attend to any person in our community that needs help is available and readily available. We will not be, just as all other of the 17 institutions, and frankly, most public and private institutions nationwide, we will not be doing baseline testing at the point of entrance. We will, however, be adopting a protocol called SMART testing. That means that any person who feels that he or she has been exposed to the virus or is experiencing any symptoms, no matter how mild, will have the opportunity to be immediately tested. And if having been exposed or actually contracting the virus, will have a place to continue their education or their work in quarantine or in isolation. We have other reasons for opening, not just that our students, most of our students, not all, but most of our students are very anxious to get back. We also want to make sure that our employees are able to stay employed, and that there is a continuity of function for this institution that is needed. This is not all about dollars and cents. It's actually about serving our needs, the needs of our students and the needs of our employee base. But any reasons to open are only valid if they are predicated with another statement about the health and safety practices, which we have adopted and are continuing to implement, and frankly, that we will continue to adopt all the way until August 10th when we open, and certainly throughout the first number of months together as we go through the fall semester. I'm a big believer that UNC Asheville has a lot of advantages in this uncertain, difficult, and even fear-producing environment. For decades, given our scale and our size, and the institutional values of decency, civility, respect for the individual, and respect for a sense of community care, I believe that we have the traditions in place to adapt to what COVID forces all of us to do. We will wear face coverings, each and every one of us, all the time. And we will do it not just because it's a rule, it's because of the way we demonstrate our care and concern for each other. We will keep 6 feet apart, and where we have to be closer, for example, in a lab, we will have plexiglass between us to protect the transmission of the virus itself. We will observe respiratory hygiene and not cough on each other, not touch our faces. We will wash our hands thoroughly. We will check our symptoms every single day for each one of us. We'll have thermal sensors available across campus so that anyone who has a fever can be given that alert and have the symptom checker follow up and a test as needed. And we will have adequate quarantine and isolation facilities for all of our students who have been exposed or been contracted the virus. We will also be an academic community of care. That means we recognize that the threat in us and around us is not just about the pandemic. There is an understanding on the part, I hope, of every one of us that we are in a moment of reckoning regarding social justice and injustice in this nation. All of us are aware of the violence that has come to too many individuals, not just in these last several months, but for centuries. The scourge of racism is upon us again. For many, it never leaves. For all of us, we need to remember that this is the great social issue of our day, and frankly has been for quite some time. COVID brings us to a point where we can see and is laid bare the medical inequities in this nation, the medical inequities in our city and our town and our community. We need to continue to address the issues of structural racism on our own campus, within our own policies and procedures, and even as it relates to the naming of our buildings. One step forward, I hope, over the next coming months will be to request of our Board of Trustees that at least one of our buildings and perhaps others be renamed so that any reminder of the validity of slavery in our past is cast aside and rejected by our community. As COVID has revealed these injustices and as we have observed the violence, as we come back together in this time for fall semester with as many of us in person as possible, I hope that we will see these matters together with our attention to our health protocols and the rejoining with one another in person as among the highest priorities, particularly in this season of a US presidential election. COVID will be present with us for a while until there's a vaccine, which now is estimated to be at least a year or 18 months until it is ubiquitously available to all. Given that, we have work to do, and we must ensure that each of our individual actions operate at the very best level for the safety of others. With those brief opening remarks, let me move to a couple of the university-related questions that we received and answer these as quickly and succinctly as I can, knowing that we can continue to see in the chat other comments. First question, I noticed the plan uses the word must when referring to wearing a mask in public. However, during the last town hall, the Chancellor stated that she cannot require mask usage. Well, frankly, that is an example of the ever-evolving situation. I now, as a state employee with you all, can require of all of us that we wear face coverings, again, of any type that cover both our mouth and our nose to prevent the transmission of the virus. Can you be a bit clearer about testing? What will you actually do? We will have a plentiful supply of tests available through our health center, through the County Department of Health, through MAHEC, and through Mission Hospital. We have been very direct conversations with these folks for a number of months now. We will test any person who would like to receive a test, given that they are experiencing even mild symptoms or have fear or uncertainty and want to be confirmed. Third question, will UNCA insist all community members wear masks at all times except in dorms, and when not available to be socially distant outside, as other UNC system schools have done? Yes, us being outside is helpful, but we will require masks as we transit from one building to the other. And you'll notice when you return to campus, hallway directional signs on the floor that, very similar to our grocery stores or other retail areas, will direct us in one way to reduce any of the crossing of one another where our faces and transmission of the COVID virus could occur. What are we doing in buildings to mitigate airborne particles and virus? Our colleague in physical plant, Dan Crossent, has written, he is a mechanical engineer. He has been the one testing all of our HVAC systems across the entire campus. And he has written such a long and detailed answer to this to brief me. I'm going to ask Sarah to put this up on the COVID website, on our website. In short order, with the exception basically of Justice Hall and perhaps one or two other places, our teaching locations have at or above the minimum standards of ventilation capabilities to prevent that the duration and the concentration of persons in any one room are disproportionately at a disadvantage to receive COVID particles. So more on that later, and the FAQs on the COVID website will include his answer. Next, for those who may test positive on campus in the fall but show no symptoms at first, is there a plan for tracing and alerting students? I am pleased to tell you that one of the grants that we have just received came from the North Carolina Policy Collaborative through the Board of Governors and UNC system. We will receive shortly $610,000. $270,000 of that money is designated for UNC Asheville Center for Health and Wellness, led by Dr. Amy Lenu and her colleagues, to conduct a statewide study on the comorbidity factors for deaths of COVID. We'll be doing that. The other balance of the money can be used by UNC Asheville. Some of it we will share with Western to make sure that we are doing the right thing on all of our restrictions. That means that we also can adopt a student health advocates group and pay students who will be available to help other students to comply, to help us spot repeat offenders. We don't know what protocols we'll be using for those repeat offenders, but we will be prohibiting them from continuing to go to class unless they have in mind the community expectations of everyone cares for all. Those health advocates will also be joined by a group of students chosen and paid to be social bridging mechanisms for health education in our community, particularly in indigent communities, in some of our school systems for special help for students and teachers, and other places where we can bridge the divides in the Asheville and Buncombe County area. Number 6, if state or county restrictions tighten, or if we return to phase 1 of reopening and cases continue upward, what can we expect that will be done by the UNC system to start us in person on August 10th? So we watch daily state instructions, including the one that came about face coverings yesterday for all state employees as a requirement. If it happened, and we already know, according to the epidemiologists at UNC Chapel Hill, that the peak in North Carolina is at this time predicted to be late August or early September. We know that. We also know that our region have flattened the curve fairly early, and we've had, relative to other places, a lower caseload and a lower increase day over day, although in the last 5 days, we've had a series of days with large increases. We are monitoring that. We are every day in consultation with the public health department, and on certain days when we're unclear, we can talk directly with Dr. Jennifer Mullendore, who is the public health physician in charge of Buncombe County. If it comes to a point in July where there is too much spread of the virus, or the governor reenacts a stay-at-home state plan, or Dr. Mandy Cohen, who's the state health official, says that we need to go backward rather than forward in the reopening, we will adjust accordingly. Is there a chance that we could get very close to opening and be stopped? I think that's unlikely, but I do think it's a possibility. Could it be that we all get 6 or 8 weeks into the semester and we are asked to close for the reason of COVID rampancy in some way? That could happen. We hope that is not likely. All things are evolving, and that is the uncertainty that I can tell you all of us working on the plan feel so deeply. The next is, what is the plan when the inevitable happens, when there's an outbreak of the virus that starts to spread through students, faculty, and staff? Well, first of all, we have a culture of community care here that I admire and prize for all of us. If we have an outbreak of a number of individual students that are not connected through a classroom or a hallway on a residence hall floor, those students will be treated just as though they even had the flu, which is a contagious thing. They will be tested. They will be contact traced by some of our student health advocates trained by the Buncombe County Health Department. And those students will be isolated or quarantined. Any student who tests positive will be isolated immediately for a minimum of 14 days and will be under the care of our health and safety, or excuse me, health and medical center led by Dr. Jay Kutzbach. If we have a large outbreak and we don't know what large is, I don't even want to suspect what a number would be. And we believe that it's in the best interest of the institution. We would be working directly with the system where the decision would be made to move us back to online only. If a student tests positive, will the school inform their roommates, classmates, or instructors? We have a very good program of crisis care right now for any student who would have gotten sick in years past. We will employ that same thing. We will contact trace every one of the contacts that any positive testing student would have had. We will not be informing people and revealing the student's identity because we have privacy laws to abide. But we will take all of the necessary actions that the community takes, that the hospitals take, that anyone else who contracts COVID does. We will be following those best protocols and have a team of students and staff prepared to do some of that. Will students who contract COVID on campus be allowed to withdraw and receive a refund? Everything will be done on a case-by-case basis. It will be done with a humane and supportive spirit, whether it's a faculty, a staff, or a student who becomes ill. So everything will be approached on a case-by-case basis. And the protection and health and safety of all others around that student will be also a high priority. There'll be some questions here about in-person graduation, and Kai, I'd appreciate it if you'd pick up there and then I'll take the next section.
So yes, the plan for commencement remains that we will have in-person commencement on Saturday, August 1st. We are looking to get a message with details out to students by tomorrow. I will say a little bit more about, let me say now a little bit more about what our plans are. We're looking to have graduates be able to participate in a ceremony on the quad. The ceremony is currently slated to start at 8:30 p.m. and will be streamed live. We will set up drive-in movie style areas in parking lots for families so that they can view the ceremony either on their phone or other devices or on large movie screens, being able to do so from within their cars. We will proceed with this setup as long as weather does not include lightning. And if lightning does occur, we do have a bad weather plan that essentially builds on the idea of carpool commencements that some have deployed. But hopefully we will be able to all be together on the quad, socially distanced, of course, and have a ceremony in real life. We will have approximately 60 beds available for students on campus to reserve for Saturday night. And we anticipate blocking some hotel rooms in the area at reduced rates. The beds that we would have available on campus would be free of charge. And those will likely be first come, first serve. Again, all of these details and more will be shared in an email and posted online. The information will be updated frequently over the next few days.
Thanks, Kai. I want to go back to my earlier comments about racism in our midst. We had a couple of questions I want to try to address. What is the university planning to do to respond and act on the recent call for racial justice across our country? We'd like to know what institutional changes and action steps will be taken, and we would like to know what resources will be provided for around racial healing and trauma. Heather, would you speak very quickly to the work that you are doing in summary fashion, and then we'll pick up on a few more of these issues.
Yes, sure. Thank you, Chancellor, and thank you everybody for joining us today. So, we do have a lot of work to do to address the anti-Black racism that we are seeing in our country and in our society, and work to do on our campus. We had been working on, and this is the work of our Diversity, Equity, and Inclusion Committee, to have racial healing circles. And so we were going to have this spring a train the trainer session on racial healing circles so that we could conduct them across campus all fall. We are working to figure out how we can do that virtually to move that work forward. We also want to support those racial healing circles with additional anti-racism training. And we've gotten some funding so that we can do that. In addition to that, we need to continue the work of, when we're onboarding our new faculty and staff, talking about bias and racism and how we create an inclusive community. We did also this spring, we ensured that all of our faculty search committees received bias training, and we talked about how bias can inform, a search, and how that can affect the decisions that are made, and who both wants to come here and who feels welcome here. So we have a lot of work, a lot of training, a lot of education to do, and we're going to continue to do that work and add staff to that as well.
Thank you, Heather. Another question was, what supports will be available for African-American students during this traumatic time? I'm asking that Bill Haggard and Kai work together to provide support systems in addition to those that have already been in place at the institution for a long time, to deal with the pain and the fear that so many of our students are experiencing at this point in time. I believe that this is also an issue of support for our African-American colleagues, our faculty and staff, who find themselves in a place to be reminded again that the racial injustice in the country continues and is disproportionately affecting so many in this nation. So I am asking, and frankly, I am expecting that we as an institution, as Kai has already said in our plan, will adopt one theme at least of attention to reducing racism, bias, bigotry, and inequity on our own campus. We, each and every one of us, has a part to play. And in that, we too can be of real support to our Black and Brown colleagues who find these times, as I have heard and listened, so very oppressively painful. And so I hope that as we reconvene, this will be one of our top priorities, not just for talk, but for action, and for action in sustainable ways to make us a better, more humane, and more socially aware community and academic place for our students, our faculty, and all of our staff. Kai, I'm going to turn back to you now for the academic affairs section, which frankly has the largest number of questions. So let me turn it over to you, and then we'll go on to Bill and to Heather.
Yeah, thank you. So let me go through a number of things. A number of the questions had a similar theme. And so I'm just going to talk through much of what we've decided for the fall and hopefully get through a lot of the questions in doing so. There will be some courses that are offered fully online. In most cases, that will depend entirely on the faculty member teaching the course. I want to remind faculty that there are 2 forms that you can complete to make a request for teaching fully online. One is the HR form. That form is for those who believe that they meet the criteria set by the CDC for having or living with someone who has certain vulnerabilities. health vulnerabilities. For all others requesting to teach online, there's another form sent out by me that you would need to complete. The deadline for my form is hopefully is tomorrow, and hopefully folks will be able to complete that form. It really asks just a set of 4 questions, and it's very easy to fill out. The HR form does require having some medical information, and so through those 2 forms, we hope within the next week or so, we'll be able to determine which classes will be fully online. Once we know which faculty will be fully online, we'll know which courses are fully online. The remaining courses will be delivered in a hybrid mode. Courses of 20 or more students will almost surely meet 1 time per week in person, and the remaining time virtually in some way. I do want to highlight that in the narrated plan, I did make a mistake, and I just said that the courses will be meeting one time instead of 1 time per week. And I want to clarify that. I meant to say 1 time per week that the classes will be meeting. And again, the remaining time virtually. Smaller courses that are under 20 students enrolled may perchance meet more often. Much of that will be determined over the next couple of weeks. There will not be a dedicated fully online only option for students. But once we know which courses are going to be online, fully online, students, we welcome you to take, we welcome students taking any of those courses, and it may be possible to construct a schedule of only online or mostly online courses. But fundamentally, that is the only way that a student can have a fully online schedule, by simply picking and choosing the courses from the offerings that happen to be taught that way. If students have illness or need to be out of class for any reason, COVID related or otherwise, we are asking that faculty have greater understanding for absences and work through staying connected to the students that have to be absent from those courses. And we're handling those cases in much the same way that we would handle cases of flu or mono or other illnesses that take a student out of the class for some time. As noted earlier, face coverings will be available for all faculty. We do have an expectation that everyone in our community is wearing a face covering. And in particular, if we anticipate that this requires something like a face shield, then we will have available face shields. If students don't have a face covering, if they show up to class having, for example, forgotten their face mask, we will direct students to masks. We will have some available in the buildings and classrooms. And if a student refuses to wear a face covering, then they'll be simply asked to respect the community expectations, and if need be, remove themselves from the class. We will be developing protocols that are probably governed through student affairs that will respond to students who persist in refusing to comply with our community standards. But we certainly fully expect that, like with other community standards, we will have full compliance. If students need particular face coverings like face shields as opposed to face masks, perhaps because they're in a particular lab space that demands this, we will be looking to provide those kinds of specialized face coverings for that particular circumstance and application. There are a number of questions that were asked about particular kinds of course spaces, performance spaces, studios, lab spaces, and the like. We're working hard to pay particular attention to those needs. And if you have questions about your discipline and its functions or spaces, I want to encourage you to be in touch with the chair or program director, and then the chair should be in touch with the deans. Each of the deans is serving in an emergency operation in that EOC, the Emergency Operations Group, and will work with you to determine the best course of action. Many of these are very specific to the particular circumstances, and so it'd be very difficult to kind of go through all of those circumstances here right now. There have been questions about particular courses that are materials intensive? Should there be sharing of materials? Again, this depends very specifically on the ways in which materials are used. And we certainly want to encourage people to have their own sets of materials and to limit sharing, but it really does depend on the particulars of the situation. Again, asking folks to work with their chairs, who will work with the deans and the EOC to determine the best practices for the particular situation that you are in. Many have asked about the availability of various technologies, cameras, microphones, document cameras, and the like. We do have some microphones and cameras available. We did order a few more. And so we are just beginning to work through the process of how we're going to make those technologies available to folks. It is likely that we'll have a process that's very similar to what we had when we were making laptops available at the end of the spring semester. Finally, we've talked about 3 themes of work: COVID, racism, and the US elections, about which we feel that there is an absolute imperative for us to engage. Over the next 2 weeks, I'll be reaching out to both specific groups and inviting on a broad scale folks that are interested in these topics to be involved. The hope is that I will have a very small task force for each of these areas that will guide us in what we're going to be doing in each area. How do we have the best ways to engage outside voices? We know that we're still going to be in an environment where bringing speakers or bringing the opportunity to have an on-campus debate may be very difficult. So how do we do that with virtual resources? Well, that is one question that we'll want to think through. How do we support the expansion and connection of these issues in existing courses? How do we possibly even develop specialized new courses for the winter session, certainly, the potential for a winter session, certainly, and even potentially for new courses for the fall? Obviously, we have to decide that extraordinarily quickly, but that's something that we need some help over the next 2 weeks, really working hard to try to figure out what does that look like. So again, please be on the lookout over the next week for an invitation to join a task force. I will be reaching out to very specific groups, committees on campus that are already engaged in this work, people that we know that are already engaged in this work. But then there will also be a broad invitation as well. So look out for more. And I do expect this to be faculty, staff, and students engaged in creating what these opportunities look like. So very broad-based involvement from the community on these topics. I think that's it, and I'll turn it back over to you.
Thank you, Kai. Appreciate all your leadership in this time. Bill Haggard, let's move on to some student affairs questions.
Thank you, Chancellor, and good afternoon, everyone. It's good to see you, even though I can't see you, but it's good to be with you virtually. Several questions about what the out-of-classroom experience will be like and how are we communicating that with our students, and will others know what we're communicating with our students about the out-of-classroom experience. So let me first talk about that communication. We're currently involved in producing some short videos that we will be sending to students, explaining what some areas of student life will look like, especially housing and dining, and Highsmith and recreation and other activities. So we are actually going to be doing that communication with our students more towards the last month prior to August 10th, so that the information is as current as it possibly can be. But we are working on those strategies and redundant communication strategies that will include other forums as well. What campus life will look like, first in our residence halls, I've gone over them in our previous town halls, but some updates. Our residence halls are currently being prepared, and there is signage and floor decals and other things that are creating different traffic patterns and one-way stairwells and that type of thing. We are, again, creating 54 additional single spaces for those students who want to have a single room. So we're increasing that availability this fall. We are looking at each and every common area in our residence halls, and they are naturally smaller because of our size as an institution, but we will have capacity limits on lounges, capacity limits on our community kitchens, and other things to reduce that to reduce the density in those areas. We are expecting, as has been talked about before, that face coverings will be worn in residence halls, except when you are in your room or your suite. A room or suite will be treated as a household, but when you leave your room or suite and go into the hallways or other common areas, we will expect face coverings, social distancing, and all of the recommendations that we're making for the entire campus. There have been questions about dining, a specific question about dining. Will we be able to eat in Brown Hall? The capacity for Brown Hall will be reduced to around 100 to 125 people. We've been in the process this summer of moving tables and chairs out, rearranging furniture. There will be some additional plexiglass and sneeze guards in certain areas, but we'll be reducing that capacity, but also creating, again, new traffic patterns, the opportunity for those who want to take out to go in one direction, the opportunity for those who want to eat in to go another direction, for an example, and trying to control the traffic so there aren't crossed paths in that process. Our other retail areas will all be open. They will have strategies to reduce the capacity there as well, and to distance folks as they stand in line. They're already, I know in Highsmith, there are already floor decals on the floor for people to stand in line for the Highsmith food court, for example. Furniture has been taken out in the down under in the bottom of Ponder Hall, and additional dining space has been created in certain areas, including outdoor dining space will be created as well, with some additional table and chairs for that. There were some questions about campus recreation and that we haven't heard yet in our communications and especially in the plan that we released on what our exact plans are for campus recreation, and especially the fitness area. The reason for that is because we will be following state and county guidance on that, and state and county orders, just as for other gym type facilities. But we are in the process of making plans. The campus recreation staff is gradually coming back and working on the facilities and they'll be moving some equipment around, creating social distancing. And it is also our plan right now to use a new smartphone application to make appointments for workouts to help control the crowds, rather than just everyone coming when they want. There'll be an online opportunity to make appointments as a way that we can control the capacity in those areas. So more information on that will be coming soon. Also, questions about the shuttles. We will have to reduce the capacity in our shuttles. We are currently looking for additional small vehicle shuttles to add to the fleet on particular high density routes. We are looking to do that, especially for our route that serves the Steam Studio and 838 Riverside Drive. That's a high priority for us. And there's also a high priority for us to increase capacity for the shuttle that comes from the Verge to campus. So there'll be more information on that later, but you will be expected to wear a face covering in the shuttle, and there will be a decrease in the capacity in those shuttles. So those are some of the highlights of the questions for student life. If I was not able to cover your specific question, please feel free to contact me directly individually. Thank you.
Thanks, Bill. Appreciate all that you and your team are doing to get that big footprint of campus ready, including all of our transportation and dining. Thank you so much. Heather, let's talk about the HR related questions.
Yeah, so again, thank you everybody for your questions, and Chancellor Campbell said this at the beginning, but your questions also really help inform us and make sure that we're communicating the right things to everybody. And like Bill said, if you have specific questions that I don't answer here, please do reach out to me or to anybody on the HR team. So talking about returning to campus, I want to remind all of our faculty and staff that we did send out a form where if you feel you need accommodations, or if you have a situation where you feel you're in a high-risk category according to those CDC guidelines, please look for that form. It's on our website. We emailed it last week, and please fill that out. For those of you who might not fall into those categories but still want to telework, we are going to be sending for the staff, because I know faculty have received a form from our provost, but for staff, we're going to be sending a teleworking form out to you either tomorrow or early next week. We're just getting it into a Google form so it's easy for you to fill out at home or virtually. And so we are really encouraging folks that where teleworking works, where it is efficient and where you're still able to connect with your colleagues and with students and others who you need to connect with, that we're encouraging this teleworking to maintain social distancing. We will be scheduling a meeting with supervisors and managers about how to address these concerns, how to be equitable and fair when you're deciding how teleworking will work and who needs to be here. So we'll be scheduling that hopefully for next week. And then we also are working with all of our campus partners, so with health and counseling, with communication and marketing, with academic affairs, on a reorientation to campus for all of our faculty and staff. We'll do something similar for students. As Bill Haggard mentioned, we're creating videos that we are going to have on our website that will help show you what campus looks like, what the classrooms look like, what the stickers on the floor look like, so that you have visuals before you're back. And that'll be part of this reorientation. We'll be talking about our community standards, wearing masks, washing your hands, keeping social distancing, really, making sure that we are a community that cares about everyone and about the health and safety of everybody on our campus so that we can be here and be safe. A couple of specific questions that we got. One was about the Labor Day holiday. So that is a holiday for our leave earning staff. We're going to keep that as a holiday. If you are in a position where you support some sort of academic function, and since we have classes on Labor Day, please work with your department chair or your supervisor to take a different day as a holiday, but that is going to remain as a holiday for our staff. There was a question about childcare and children on campus. And as a working parent, I can tell you that's a significant concern for a lot of our folks. We don't know what K through 12 is going to look like in the fall. We don't know what daycares and preschools are going to look like. Although I will say, our chancellor and our other leadership are in close contact with the schools to make sure that we are keeping abreast of what they're saying. Right now, they anticipate opening on August 17th. I recognize that for a number a week then, right, between August 10th and August 17th, where the schools won't be open. We are looking at finding some sort of resource for some sort of summer camp. We're working with Darren Waters and John Pierce. We're talking to the YMCA and a few other folks to see if that's something we could do to bridge that gap. Again, not knowing what K through 12 will look like. And so that's going to be something that we're going to have a continual discussion about, can continue to communicate with folks on our campus. It sounds like from one of the questions, people would like some real firm guidance about whether they can bring their children to campus or not. And so that's something that we will work on. And I think I've covered all of the questions. Chancellor.
Thank you, Heather. I want to urge everyone on the call who is faculty or staff to see Human Resources as a great place to ask your specific questions and share your worries in strict confidence. Heather is a terrific leader in this institution, and she has the instincts of humanity in her heart, along with her staff, who are also trained to give the right and proper questions, but then to work within exceptions that need to be made. So thank you, Heather, for what you're doing.
Absolutely, thank you. And thank you everybody for your questions, and we've had in the division meetings and in the town halls. And please, again, keep coming to us with your individual circumstances. We want to hear all of them.
Thank you. Sarah, you may be on because we've had some questions asked in the chat before final comments. Would you like to offer up some more questions for us to tackle?
Yes, thank you. And thank you all for the questions that have come in the question and answer chat feature. Many of them relate to academic affairs, Provost. There's a question about whether faculty are expected to attend graduation.
Sorry, couldn't hit that unmute button. So we need, in fact, a smaller group of faculty to participate. And so we're hoping that when we go out and invite faculty to participate, that we have, I think roughly 40 is the number I believe that we need. All of this will be determined. I think we have these numbers, they're not on the tip of my tongue. So I think that our hope is that we will get those faculty to participate just by virtue of asking, and those that are not able to or feel that it would be too difficult to participate won't have to. And we will adjust as necessary. So that's roughly how we will handle that.
Some additional questions for you, Provost. Can an individual faculty member choose to agree on an individual student request for a fully online experience? And this one also might be for you or Heather or Vice Chancellor Parlier. How does a student request an online experience if they need one?
Yeah, so and I think I've offered an answer in the Q&A, but you know, it is probably going to be handled on a case-by-case basis. Every time, for every student, there's a different situation and a different circumstance. And we want to really be mindful and be helpful, but it is not possible for us to sort of just say that we will offer this for any student that wants to be fully online. We simply don't have the ability, the capacity, the resources to do that. And so we will do our very best to accommodate, to work with students, to work with schedules, to work with faculty. But we may have to think more creatively and in different ways about how we support students in this environment.
Thank you. There's a question about when we will know if their classes are going to be online.
So we're working through that, and someone actually, I think, corrected me. I said that the deadline for getting back to us from faculty was tomorrow. It is whatever I said it was in the email that I sent.
June 26th, Provost.
Okay, so if that was next Friday, then that's right. So I apologize for misstating that deadline. But as soon as we have that information, we're starting to look at that information now and tracking what we're getting, what we're seeing, and we're trying to figure out which of those classes, which of those faculty will be teaching fully online. And like I said, that's really the big decision. Who is teaching online? And then the courses that will be online will be those that are offered by those folks. And so I know HR is receiving that information for medical situations. We're receiving that for other kinds of requests and flexibility being requested. And you know, frankly, my hope is that we are able to be as generous as possible and to be able to provide the opportunity for faculty to be able to teach online. You know, so and in fact, there's an extent to which we need some of that extra capacity to thin the on-campus physical infrastructure burden. So, you know, we'll assess and be making those decisions and sharing that information as quickly as we can.
Two additional questions for you, Provost. One is just a point of clarification. Starting August 10th, if your class has 20 plus students, the question is, will it be hybrid?
So all of the courses, so we're anticipating that almost every single course will be hybrid. And so there will be a need for almost all courses to be a combination of one in-person meeting and then the rest online. If your class is smaller, there's a chance that our classroom capacity will permit some greater engagement, in-person engagement. Frankly, sitting here, I don't know how many courses that would that be. We, as folks know, we are in the midst of Embark, and we're taking on students, enrolling, scheduling students that are incoming first years and transfers for courses, with courses. And as that happens, we will know more completely what are the enrollments in each of these courses, and therefore where do they need to be mapped. Where will those courses be taking place? What physical classrooms? I do want to say there are a number of these questions that that we are trying to compile in an academic affairs kind of specific, classroom specific set of kind of frequently asked questions. I do anticipate releasing those soon after, by tomorrow or so, so that folks can really have a written document of that lays out a lot of these things.
Thank you. And then the other question was just about reiterating the precautionary measures that are taking place in classrooms and labs to ensure the density is reduced and the protocols are in place.
So yeah, so that work has been really underway for quite a while. And I'll just mention a few things. So David Todd, Keith Crumpy, David Weldon, and their teams have really done outstanding, really hard work to get this done. They are looking at everything from how to create the right kinds of directional spaces, directional traffic flow within buildings. So one-way corridors, one-way stairwells and the like. They've put up lots of signage, and there are some videos being prepared that will demonstrate, that will show kind of what these spaces look like. So please be on the lookout for some of those videos coming out fairly soon. They have also taken out permanent chairs to remove that and put in movable chairs, put in sneeze guards, and there are more sneeze guards coming in. I think that for the most part, the ones that they have installed already are the sneeze guards that are kind of front to back in classrooms that have the need. So if you have a rows of seats that are facing forward, the sneeze guards that are between rows are in place. There will also be sneeze guards put in place between chairs when those chairs, when they've deemed it necessary to do so and to adhere to the best health protocols. But to a large extent, spaces, desks and seats have actually been completely removed from classrooms to create the social distancing necessary in classrooms. So we now currently have a new set of capacities for each one of the classrooms. I think all but maybe 10 or so classrooms have already been determined with a new set of capacities. So now the work is, how do we map the existing class schedules onto this new set of classrooms with their now COVID capacities?
Thank you very much. There are many other questions that are coming in, and unfortunately we are running tight on time. So we are getting to those questions in the chat, everyone, and please feel free to reach out and email your questions to anyone here on this chat or your supervisors or managers, and we will absolutely do our best to answer those questions for you. And in the meantime, thank you for being so engaged. Chancellor, I will turn it back over to you.
Thank you, Sarah. And thanks everybody for joining us. I want to say how grateful I am that you are now, and I hope you will continue to share your worries and your concerns. That will help all of us adopt principles, practices, things that will reduce worry, but also allow us to have the healthiest possible environment for our return to in-person instruction. Thank you for your patience with us. The truth is, we're learning as we go. Many times we're not even sure what new rules or regulations might be coming or should be anticipated. So thank you for your patience with us and your perseverance in kind of leaning forward into some goodwill. This is a moment, in my view, for all of us to lead the institution in our own ways. It's not senior staff alone who can lead. All of us have a role to play. And in that role, I would ask that we strive to assume positive intent. There is only good intention here and in play as we put the plan together, as we continue to improve it, as we continue to clarify it. So I hope I invite all of us to share that leadership role of assuming positive and good intent of those around us. You know, we have many academic strengths at this institution, but I wanted to close today with a reference to the humanities and an historical quote from Abraham Lincoln. In the mid-1860s, Lincoln was once asked, "When will the Civil War end and how will it end?" And Lincoln's response is as follows, and I quote, "The pilots on our western rivers steer from point to point, as they call it, setting the course of the boat no farther than they can see. And that is all I propose to myself in this great problem." Now, while that may sound short-sighted, it was anything but. We know our destination. We know our purpose, eventually to beat COVID, to return to in-person instruction, and as an academic community that prizes one another and prizes our shared work. But all we can do in this particular situation is safely and with deep respect and care for each other, move from point to point. And that is exactly what I'm inviting us to do as we wade our way through crafting a workable, high health standards plan that is in the best interest of each one of us and all of us. So thanks again for joining us. We'll do more town halls. Be in touch if you have direct questions with any of us or any on campus who can help. And I'm so deeply grateful to all of you for all that you continue to do for the University of North Carolina, Asheville. Thanks for joining us.